Polio, short for poliomyelitis, is a highly contagious viral disease that has plagued humanity for centuries. It is caused by the poliovirus, which primarily targets the nervous system. The virus spreads through contact with infected feces or droplets from coughs and sneezes. Most infections cause mild flu-like symptoms, but some lead to paralysis, lifelong disability, and even death. Polio has been particularly devastating to children, often leaving them with withered limbs and the inability to walk. Historically, polio outbreaks were a recurring nightmare, leaving communities terror-stricken. The virus knows no social or economic boundaries, striking indiscriminately across the globe. The fear and uncertainty surrounding polio, especially in the pre-vaccine era, cast a long shadow over families and societies. The sight of children struggling with paralysis, confined to iron lungs, became a haunting symbol of the disease's devastating impact. The 20th century witnessed a turning point in the battle against polio. Scientists around the world raced to unravel the mysteries of the virus and develop a vaccine. Their dedication and tireless efforts led to two groundbreaking discoveries: the inactivated polio vaccine, IPV, developed by Jonas Salk in 1955, and the oral polio vaccine, OPV, created by Albert Sabin in 1961. These vaccines proved to be remarkably effective in preventing polio infections and dramatically reducing the number of cases worldwide. The introduction of polio vaccines marked the beginning of a global eradication effort. Spearheaded by organizations like the World Health Organization, Rotary International, and the US Centers for Disease Control and Prevention, mass vaccination campaigns were launched in countries around the world. These campaigns focused on reaching every child, especially in underserved communities and conflict zones, where access to healthcare was limited. The success of these campaigns hinged on the dedication of countless healthcare workers, volunteers, and community leaders who worked tirelessly to immunize children and raise awareness about polio. Over the following decades, the world witnessed a dramatic decline in polio cases. Countries that were once ravaged by the disease began to report 0 cases, signifying a major victory in the fight against polio. The Global Polio Eradication Initiative, launched in 1988, played a pivotal role in coordinating global efforts and mobilizing resources. The GPEI's comprehensive strategy involved not only vaccination, but also surveillance, outbreak response, and advocacy. The eradication effort encountered numerous challenges along the way. Political instability, armed conflict, and logistical hurdles in reaching remote areas often hampered vaccination campaigns. In some regions, cultural beliefs and misinformation about vaccines fueled hesitancy and resistance. Addressing these challenges required innovative approaches such as engaging religious leaders and community influencers to promote vaccine acceptance. The success of the eradication program relied on adaptability, perseverance, and the unwavering belief that a polio-free world was within reach. As of 2023, wild poliovirus remains endemic in only 2 countries, Afghanistan and Pakistan. The challenges in these countries are multifaceted and deeply rooted in their socio-political contexts. Ongoing conflict, insecurity, and limited access to healthcare have hindered vaccination efforts. Moreover, the persistence of misinformation and distrust of vaccines has created pockets of unvaccinated children, leaving them vulnerable to the virus. Despite the immense challenges, the commitment to eradicating polio remains steadfast. The Global Polio Eradication Initiative and its partners continue to work tirelessly, employing innovative strategies to reach every last child. These strategies include tailoring communication campaigns to address local concerns, strengthening surveillance systems to detect and respond to outbreaks rapidly, and engaging with community leaders to build trust and encourage vaccination. The final push to eradicate polio requires unwavering global solidarity, sustained funding, and a collective determination to consign this crippling disease to the history books. The eradication of polio stands as a testament to human ingenuity, perseverance, and the power of global cooperation. The journey has been long and arduous, marked by both triumphs and setbacks. Yet the dream of a world free from polio remains firmly in sight. The lessons learned from the polio eradication campaign have paved the way for tackling other infectious diseases and have highlighted the importance of investing in public health infrastructure. While the end of wild polio transmission is a momentous milestone, the fight is not over. The threat of vaccine-derived poliovirus outbreaks, which can occur in under-immunized populations, still looms. Maintaining high vaccination coverage, strengthening surveillance systems, and addressing vaccine hesitancy are crucial to prevent the resurgence of polio. The world stands on the cusp of a historic achievement, but vigilance and unwavering commitment are essential to ensure that future generations remain free from the scourge of polio.